All right, welcome. My name is Dr. Susan Payrovi, and I'm one of the three people that's going to be talking to you today. And we are so excited to be bringing a program to you that we think is front and center when it comes to MS care. This is the stuff that gets pushed to the side and nobody talks about. And we're so fortunate to have Dr. Ardeshir Mehran here with us, along with Sanam Saeedi, who's a wonderful health and life coach. So we have a wonderful program prepared for you. Thank you all for being here. I think of this hour as the time we give ourselves to learn, to be inspired, to find new ways of doing things. And so I want to make sure that you walk away today with a very clear understanding of things that you can be doing to improve your health. So today, we're going to be talking about new tools for MS, for you as a whole person, not you as the person who has MS and we're going to use medications to treat your physical body and physical symptoms. We're going to be digging deeper into places that are sometimes hard to go. And we are going to be talking, or Dr. Ardeshir is going to be talking about the role of the body in allowing us to heal and to try to bring the body back into that realm. So part of what we're going to do today is to try to figure out how to create healing in our bodies and how to get to a resolution from our past emotional experiences. All of this so that we can unburden the body. You know, we as people who live with MS have a lot of physical symptoms related to our immune system's dysfunctioning. So is there a way to unburden the body to lessen the impact of MS? So we're not going to be giving you any specific healing recommendations. We are here to offer information to you. If this resonates with you, please reach out to us. I am going to put all three of our websites into the chat and feel free to reach out and connect. And then before you leave, we're going to give you some actionable steps. Okay, so let me just start quickly by formally introducing myself, and then I'll pass it on to our other two panelists. So my name is Susan Payrovi. I am a physician. I started out as an anesthesiologist, and currently I'm a clinical assistant professor at Stanford University in the Department of Anesthesia, but I don't practice anesthesia anymore because MS impacted my left arm. And so I had to go and search beyond what my neurologist was telling me, because in my gut, I just knew there was more that I should be doing for my health. And the irony of it is, as a physician, I didn't know that up front. I had to go learn it. And that set me on a path to learning integrative and functional medicine, Chinese medicine, acupuncture. And it's given me a really broad lens that helps me a lot when I try to work with people in figuring out how to improve their health. So I still see patients at Stanford, but I also have an online wellness program called Truemedicine, where we work with people to do the lifestyle piece of MS care that's completely missing from conventional practice at this point anyways. Okay, Sanam, go ahead.
Yes, thank you. Hi, everyone. I'm Sanam Saeedi, a certified health and life coach with focus on MS. I'm an electrical engineer with master in IT management. My diagnosis with MS in 2019 changed my life significantly. Once diagnosed, I experienced a number of emotional and physical challenges, which made me to quit my job. The emotions that I felt most deeply were anxiety, worry, fear, and sadness. I was feeling that no one could understand me and my life with MS, and I was depressed for 6 months, and I gained extra 20 pounds. So, as emotional changes are very common in people living with MS, we decided to ask Dr. Ardeshir Mehran to join us, not only discuss the connection between our emotions and our physical body, but also how to tap into its wisdom for healing the symptoms of MS. Dr. Ardeshir Mehran is a psychologist, behavioral researcher, neuro-medicine advisor, and business leader. He is also the developer of the Bill of Emotional Rights. He's the author of upcoming book, You Are Not Depressed, You Are Unfinished. Dr. Mehran will share more about his book during today's webinar. Now, before we start listening to Dr. Mehran, let's do 1 minute of box breathing together. It will help us to calm our mind and be present. So we will begin with 4 box breathing, and it's going to be like this. We're going to inhale for 4 seconds, pause, exhale for 4 seconds, pause. So let's do it. Sit tall, put your left palm on your chest and your right palm on your belly. Close your eyes. Inhale, 1, 2, 3, 4. Pause. Exhale, 1, 2, 3, 4. Pause. Let's do it one more time. Inhale, 1, 2, 3, 4. Pause. Exhale, 1, 2, 3, 4. Pause. And the last time, inhale, 1, 2, 3, 4. Pause. Exhale, 1, 2, 3, 4. Pause. Now open your eyes. Great. Now let's just bring our attention to Dr. Mehran. The floor is yours.
Thank you. Thank you, Sanam, and thank you, Susan. And greetings to everyone. I am with you today from the south of San Francisco in a small community, residential community called Burlingame. And it's a sunny day here. It's been raining like crazy. And my golden retriever is right outside. This is the time we go running. So she's looking at me and says, what happened today? So what I want to share with you are several things. One is I want to give a context about the work that I want to, and I'm bringing to your attention. I'm not here to sell you anything. I would invite you to consider my book, but I'm not here to change you, to challenge you, but I have a point of view that I want to share as clearly as I can for you to consider it. And then I will share a client story that I just finished the first phase of work that highlights what this work is all about. Then I look back some of the science around that. And then I will provide some guidance about if you were going to apply this to your own life, where do you start? Throughout the process, I invite you to ask questions. Really, my conversation at this point is person to person. Even though I see wonderful faces, it matters to me that if you have questions, ask them in the chat. And Susan and Sanam will ask that. If you have provocative questions, if you want to challenge me, please bring it on. This is, at its core, it's a scientific discussion. I'm a scientist. I'm a very skeptical scientist that I need proof, I need data, and before I decide on anything. What I share with you is I don't do fads. I'm not into sensational. Did you notice? If anything I can be criticized is the body of work that I'm sharing with you. I've been sitting on this for almost 15 years. I didn't know what to do with it. And COVID helped me to bring it out. But I've tested this, retested it, meta-analyzed it, and client results says, no, dude, you're sitting on something. This is not yours anymore. So what I'm about to share with you is that in the Western medicine, we have a unique way of looking at symptoms of illnesses as causes. Whether they are mental illness, depression, anxiety, bipolar, ADHD, and so on, all the way to schizophrenia, and then to medical illnesses, MS, breast cancer, there are multiple different illnesses. We see them as causes. These are consequences. Consequences of a body human experience that's been impacted. And the clinical term going to the trauma research has been dysregulated nervous system. That if we understand how people through their life development from early childhood, they get shaped, they get programmed, and how they adapt to respond to emotional and physical experiences, we understand illness and we can heal them better. The way I came to this realization, and this is not Ardeshir's idea, there are a lot of rich literature coming from since 1990s from the trauma research, pain clinics, is from my own struggle that growing up, I didn't know that I'm depressed, clinically depressed, anxious, mom and dad, brothers, sisters. And when you raised in a depressed family, you think you're normal. And as I went to graduate school, then I started to learn about psychology, abnormal psychology, realized that we are actually not well. And over the years, I went to 7 psychologists, psychiatrists, medication, and my symptoms would get better. I would become depressed all over again. And it was exactly in 2012 that I was having suicidal thoughts that for the first time I asked 2 different questions. What is depression? And why is it so hard to treat depression? Those 2 questions changed me, changed my lens. Then I realized that depression, and after that, my field of vision changed. Depression is an expression. Depression has a story. And from that time, I started to change my way of therapy and coaching in a very subtle way, experimenting, and client would heal much better. So heal much better in a way, what I did was instead of trying to heal the depression, heal anxiety, ADHD, bipolar, help the clients look at their lives, look at the emotional experiences they had. And I went deep into the field of somatic therapy, somatic psychology, the body, if body keeps the score, Bessel van der Kolk, Peter Levine. I've been trained by Peter Levine and Gabor Mate. And what came about that instead of having long-term therapy or coaching engagement with clients, what I saw people in a matter of 5, 10, maximum 15 sessions, they would make tremendous improvements. Number one. Number two, I also, what brought to those therapy sessions, what I call visibility, transparency. People saw cause and effect. This is happening, therefore I feel like this. Bring the science and work with the clients for them to own their body, their emotion. They were able to quickly reconstruct their own emotional experiences. Third one, the results were deeper and last longer. So people would come out of medication. And to this day, they felt better. So let me share with your client the story, and then I will reel the tape back and we'll go into what happened. So last October, I got a call from a client in Europe. So everything was done in the Zoom, and she had seen my public session that I deliver once a month about the work that I do. I'm an open source about a new way of therapy. It's a somatic-based therapeutic work. She reached out to me and says that I'm having a struggle with my husband, with my partner. He's depressed, clinically depressed, suffering, and it's really put a heavy load on our relationship. Do you have time to work with him? I said, of course. A week before that, she sent a note, literally said that, forget about him. Can you work with me? So I said, of course, so we met. So late 30, the successful business leader, rising star, has a teenager and divorced, lives with a partner in a European capital. As we met, what she shared in our call, that she's having a lot of body aches, that her back is hurting, her chest is hurting, her belly is hurting, and she's having suicidal thought. And she said, I don't have joy anymore. And I feel my whole body imploding, but from outside, nobody knows it. So what I invited to do, this is how 10 years ago, I would have done it differently. I would have asked a lot of them, getting family history about, tell me about you, what you experiencing. I went to a way to bring her body to here and now. Later on in this session that Sanam will put in the chat, an audio tape that I have is about meditation and mindfulness, which is really about bringing the person to the here and now. So as I was listening to the client, it was clear to me that there are past experiences that she has dysregulated body function. When people talk about their belly, their chest, they're a sign of trauma, and trauma, talk about it, unresolved, lingering in the body. So I guided her through a short meditation that lasted about 7 minutes, but had 3 components. When we go through life and things happen in life, we fold along 3 dimensions. The same thing happens when we have a car accident. We get punched in the face, or we have a hold up and we get robbed in the streets. 3 things happen simultaneously. One is that we have out-of-body experiences. We start to feel our 5 senses, our body, because it's a scary place. So we disown our body. We just have a body, out-of-body experiences. Number 1. Immediately, we feel a sense of disconnection. We feel lonely. We feel isolated. We feel frightened of others, because that person with that environment has been very fearful to us. Third one happens, sense of agency. Agency means sense of control. I own my body. I own my space. I own my emotions, that I'm in control of myself. So when we go through harsh experiences in life, we fall quickly along to those dimensions: presence, connection, agency. So as I was looking at her, I was very intrigued by how flat her emotions were. So we went through that exercise. I invited her to do that, and I shared with her presence, connection, and agency. Number 1. Number 2, what I did, I asked her that I hardly ask people, how are you feeling? The moment you ask, how are you feeling, how are you feeling is a cognitive left-brained way of communication. What we know from somatic work, that we have a lot more emotions than we have words for them. In fact, we do a lot of therapy with our kids, saying that, what is the word you use to tell how you're feeling? That actually is not helpful. A better way to do that is say, what's coming up for you? Where in your body you have sensations? What are you sensing in your being? So I asked this client, she said that my gut is hurtful. I asked her, left hand, put it in your gut. Where is it? She said, in my belly, lower belly. So what we know from somatic research, that belly and lower belly, these are the early childhood trauma. That's where we hold, that's a center of anxiety, sense of safety. And also she said, my heart and my chest is hurting. I asked her to put your right hand over here. And she said, I feel my heart is blank. I really feel a lot of pain in my heart. This is where fight or flight happens. I asked her to, as she's sitting here, let her body speak. What comes up for you? What emotions? So this is the first session. So there was an outpouring of feelings, emotions, fragmented thoughts, and cry, and tears would come in. And she was saying that I never felt like this, but she was bringing a lot of emotions at the moment. What I was doing at that point, again, going to the sense of therapeutic work, there's a difference between empathy, which we do as therapists, and then atonement. Atonement means that I see you as you are, with all your emotions. This is your space. I create safety for you. So I was not asking probing questions. Tell me how you're feeling. I was asking, I'm here for you. what else coming up? What else would you like to share? And because what crying actually is good. Sharing experience is good because that means we are integrating. So what she was doing, bringing emotions that for whatever reasons in the past, she could not express them. As we were ending the session, she talked about the trauma she had. She had two significant surgical trauma in her life. One was around her pre-teenager major spinal injury accident, a car accident that she was based in a wheelchair for a number of years, and she felt she was isolated. Later on, then she had a very complex cesarean with her the daughter, and she was abandoned after operation. While she was still awake in the corridor of a hospital, I didn't feel abandoned. Sense of abandonment was a theme for this client. Our session ended. The second session, when we had a week later, was doing body restoration. You see a chart behind me. This will be in my book, The Bill of Emotional Rights, that we humans, from birth to death, we have 7 basic emotional needs. Imagine that the Abraham Maslow version 2.0. Nobody's taught of that. We all know them, but we have basic needs that we are wired around them, or we are designed at the DNA level to fulfill them, to experience them. So we went through them. Those needs are: I belong, I matter, I am, I make, I'm boundless, I soar. So we went through them, and I shared with them, how do we feel them in our life at this moment? And she was mentioning that how she was experiencing at this moment. So what became clear, she was deeply lonely. Going back to her early trauma experiences, she was in a relationship, but she felt unseen, unconnected. And she was also felt that a lot of past trauma that she was carrying in life with her. That was our second session. The third session, before we meet, she sent me a note and says, I have a good news for you. I had no idea what she was going to tell me. So we met the third session. She said, Ardeshir, I have news for you. I'm leaving my partner. And she said that relationship I learned from the 2 previous sessions, that I've been living a life compromising to be loved, to be accepted, but always disown myself, what matters to me. He's a nice man. He's not the person that is right for me. I know I'll be lonely, but I'm going to go on my own and try to find the right person for me. So in that session, we went through rewiring about her childhood trauma, what happened and how her body went to fight or flight and was frozen at that point, and what would coming back would look like for her. So what happened within 5 sessions, this client, by the 4th session, she sent me a picture of her downtown of the lovely European city. She was dancing around with her friends and said, I never felt like this, to fully experience joy, buoyancy, being goofy in downtown the area. And then by 5th session, her pain went away. And I forgot to mention that she had already been to neurologists, to psychiatrist, MRI, rheumatologist. And everyone said, you're fine. And she was saying, I'm not fine. My body's aching. So by the 5th session, her pain subsided, went away. She came off the medication and she found herself. So what we're doing work right now is about her next phase of life. She has a new life partner, building a relationship based upon her authentic self about things that matter to her. A journey of healing is a journey of resetting boundaries that are right for you. Mind, body, emotion versus the past that still lingers. And she has a much better relationship with her mother and with her daughter, and is a much better leader at work. So let me look back to 1st and 2nd session and the science behind the work that I did. So what we know from the trauma work and the somatic work And the research is quite extensive, and I'll be more than happy to share them with you if you're interested, or if you go to the book Body Keeps the Score by Bessel van der Kolk, that's a great place to start. Is that the field of psychology and even field of medicine, they've been ignoring the body and the residue of memory from the time of birth. What we know is that many of us, that when we are born, we have experiences that throw us in a state of freeze, fight, flight, fawn, and freeze. Freeze is a state of basically, it's almost like in the boxing, you get punched in the gut. And the first experience is that you hold back. Literally freeze means that we become numb. We just get overwhelmed with experiences. And this happens for many people in childhood, early childhood, early school years. It happened to me, my brothers, sisters. I know it happened to my mom and dad. When freeze happened, our body goes to the state of literally stay in a state of numbness, presence, connection, and agency. We lose a sense of when in the moment experiences. We get frozen in a point in time. Our nervous system gets frozen in the point in time. So what happens, there's an event, whether it was child abuse, sexual abuse, bullying, poverty, or not being seen or loved and held or attended to. But what happened, those emotions reside in our body. But what's really more important, the energy of the experience gets reside in the body. Trauma and the state of emotional freeze is about energy that still will linger. At a certain point, it's not about the event anymore, energy that lingers. The work of healing is to help the patient to pass through the energy that resides in our bodies. Because what happened, we still going, and what we know from research is that the way we remember the memory is no longer in our brain. Actually, it's our entire body at the cellular level. So when that happened, we have traumatic experiences or harsh experiences in childhood, that our entire body, vagus nerve system, they get triggered. For many people with early life experiences, they have gastrointestinal problem, diarrhea, irritable bowel syndrome, or constipation and stomach churning. That's where the anxiety early life experiences reside. The next one is the cardiovascular. Women, by and large, have a higher rate of gastrointestinal. Men have cardiovascular, about heart rate, heart problem, and the blood pressure. This is fight or flight happening. And the third one, you will see a lot of upper back, throat, jaws problem here, tightness. And you see that even in the world of work. All of this are sign of trauma, past experiences still linger in our body. So working with this client, what she was talking about, emotions lingering in her body, number one. Number two, what's important, when emotions linger in our body, actually is not that helpful to go and do initial focus about, tell me what happened, what do you remember, for people to work through that. The work, because if the emotion's still in the body thinks that traumatic experience is still happening. Body thinks in here and now. So our brain remembers events from the past in the context of history. Our body has no memory of the time. Body thinks it's happening right now. So the work of a healing is to work with the entire body, vagus nerve system, gut, chest, upper body, and invite the client to express what's coming up for you. What emotions come up for you? What meanings? What do they need to do to bring that work forward? This work a key part of that is moving away from verbal communication. It's actually people need to move. So as I was working with this the client, she was in her living room, I would invite her, just surrender to your body and see what your body wants to do. What is important to know, brain is conceptual. Our brain, we can organize, categorize, and symbolize the language. Body is literal. Body only understands action. Our brain, tell me, body, show me. So for us to heal, body needs to move, and move can be do something, say something, scream, cry, as a way to release the energy, to release the emotions. So what this client was doing at certain point, on the second and third session, she was actually standing up, doing her downward dog yoga and moving in the room with her hand. Don't do that. I'm alone. Mom, where are you? I'm after the operating room. How come nobody's with me? So she was using her entire body to express her emotion. What she was doing, reenacting emotions she could not express at that point. And through that process, she was integrating her emotions with her thought, with her body, and processing out the lingering past emotions. And basically, she was closing the loop of traumatic experiences she had. And the part about the breathing that we did, going to at each point, for her to reconstruct her reality based upon presence, started to feel her body again, her five senses, sense of connection, realized she was lonely, and part of the loneliness, how do I repair and reconstruct my relationship with my mother? Instead of, she has a very critical mother, that instead of giving out to her, how to bring her in, create a relationship based upon partnership. And with my daughter, she was more or less, she was a critical mother for her own daughter, create a more partnership relationship. So I've done this work with a number of other clients in the past 18 months. People come to me with bipolar, with ADHD, clinical depression, with panic attacks. And one thing they all have in common, they've been to therapists, psychiatrists, medication, and their struggle is still lingering. What they all have in common, these are body signature that is still lingering through their life. But the whole aspects of MS, cancer, like in my family, I've lost a number of family members, my mom and the eldest two children, sister and brother, to cancer. They all have signature of past body emotional with the trauma and burden. There's a great research it's called ACE, the Adverse Childhood Experience. You can see it by Center for Disease Control, long-term and large-scale study that early childhood experiences, adverse childhood experiences, they have strong correlation with later life emotional and physical complication, ailments. Not every trauma leads to illness. Not every illness has, the signature of children, the past life experiences. But we know once we have experiences that we haven't quite healed, we get impacted at the physical cellular level in our bodies. The invitation for us is to know where we are at this point, and if we are having any impact, any lingering emotions that is still reside in our bodies. So let me talk about, I want to go a few more moments and then invite you to consider something. So you may say, Ardeshir, what the heck you're talking about? How do I know I have something in my body? So up to 18 months ago, I was a corporate executive in charge of business transformation. There's a fallacy in the Western world about resiliency. We glamorize it. I can eat my worries for breakfast. That we know from research that people, executives, high achievers, entrepreneurs, they have 2 to 3 times higher rate of depression, anxiety, bipolar, substance abuse, suicide than general population. For many professionals, we learn to diminish and discard and ignore our burdens. And we pay a price for it. Typically, it shows up in ailments, pain, and sorrow and struggles that they just don't go away. And we drink it away, we ignore it, but sooner or later it catches up with us. So how do you know if you're sitting or emotions that they need attention? The way you know it, again, this becomes very subjective, is that there are sense of burden and sorrow that it just lingers in your world. And there are emotions you have, instead of being bittersweet, it says, oh my gosh, that sucks. That there's just a heaviness, like a dark fog comes over you. The other thing is that there's sense of flashbacks you have. You go to work and I've seen it in some of the colleagues that have at work, there's something happens and people just blow up. They just get nasty because somebody's after somebody's throat and they just, you see things flare up quickly. Those are sign of flashbacks, sign of childhood memories that we didn't quite resolve. You have nightmares. You have certain like stomach churning, pain, chest pain, back pain that simply don't go away. Migraines that last long. So there are physical ailments that they just linger, emotional experiences that they just linger. And those are some of the areas that to pay attention to. An invitation to you as you're sitting here. Sanam brought the whole dimension of box breathing. As you're sitting here, just settle in your body, whether eyes open, eyes closed, and your body settle. And I invite you to do 3 scans of your body. This is a simple exercise about presence, about connection and agency. The sense of presence is that, can I be in my entire physical body right now? Do I feel my physical body? Sense of smell, sense of sight, hearing, sensation in my body all the way head to toe, all my organs, front of my body, back of my body, left side, right side. Like an X-ray, if you consider your entire body. And if you ask your body, what's coming up for me? What is coming up for me? Consider what's coming up for you. And it could be anything. It could be opening, can be like a green pasture. Everything's beautiful and open. You might feel tightness. Or you may not. You may feel certain parts of your body you are not feeling. Certain parts, it's, oh, I don't know what's going on over there. So just notice. You don't have to do anything, just notice. Next one, I invite you to about connection. Connection is about the being connected, sense of belonging, sense of being loved back. That you feel that you at the spiritual, emotional, heart level, you're connected. It could be to a person. could be to your pet. But you feel there's a sense of connection that you can go to be with someone and you feel your skin through eye. You're connected. And you're connected back and you're seen. The third one is a sense of agency, that you as you are in charge of your emotions, your body, your safety, your well-being, of who you are. You decide how you want to feel. You decide who comes close to you, who you invite in, and who do you say no to. You don't compromise. Presence, connection, and agency. Those are our perimeter walls of your castle. Once you have them, you're in the space of your inner safety. I invite you to, as you think presence, connection, agency, question you ask yourself with a lot of love, with a lot of caring, and a lot of appreciation. Do I need to do any work? Are there opportunities for me to enhance, to work, to enrich those areas? Notice that questions. Notice your answers. Notice even me asking those questions. Do they make you feel excited, elated, or say, what the heck? I don't want to go there. That sucks. Listen to your answer and follow your answer. You know the answer. Let me end right here and invite questions. And please ask question. Did this make any sense? Yes, please.
Thank you. That was beautiful. I love that. There was a question in the chat that says, what about lower body? Does that hold some kind of trauma?
It does. Yeah. So the way to think about what's trauma, so this is all become very individual, very subjective. It's lower body, and if the pain lingers, it comes back again. Comes back, so that's what we want to pay attention to. So there's an element of lower body, and the reason I said back of the body, this is not a direct science, but lower body, back of the body typically relates to anger. Typically relates to anger. When we have anger, we want to say something. Our back is our shield. Like when we're in the trauma, we get car accident, what we do, we curve in. The reason is our back is our inner wall. We protect our inner organ. That's where we project to the world. So the work that I do with clients, the number of them, they had the back of the neck, shoulder, lower back, shooting pain to their arms. When we work with them, there are angers, expressions that they have not had a chance to share. Typically, it has to do with the spouse, with a partner, somebody, with the boss. Opportunity is for when lower back, when you do the centering exercise, ask your body, what's coming up for me? What emotions come up for me? What colors, what movement? Body wants to be experienced and explored. Sit with that pain. That pain will speak to you. Follow what's coming up for you, will follow through you, through the answer. One thing to mention that Sanam will put in the chat, I mentioned with the client, I did the centering exercise. There's an audio version of the centering exercise. It's called Here and Now. We will put it in the chat. Feel free to use it, that it guides you through presence, connection, and agency, how to gain your balance around that. And a number of my clients, they use it, some of them almost every night for them to fall asleep with it. And the others, they use it the first thing in the morning before they start with the routine. So it's yours to use and to pass it on. Other questions?
Yes, Ardeshir John. So someone asked that, what about the jaw and grinding your teeth? Is it also related to any emotional problems?
So any body reactions that they linger, they are related. The best way to do is, again, it's not a one-on-one relationship. So the way to do that is a practical way. The tape that I've sent you, listen to it. Put your hand around where it's hurting actually. The same way with the client that I mentioned, her left hand was in her belly, was hurting, and the right hand on her chest. Put your hand around the part in your body that you feel sensation, discomfort, and invite your body, notice, ask your body, what's coming up for me? What emotions, what experiences come up for me? This is for you to discover that. And but if there's a grinding, gnashing and all of that, they mean there are basically emotions that is still stuck that we haven't been able to express. And this is a way to explore that further.
There was another great question. What's the best way to release bad energy? Can you go over that again?
I'm not trying to stand bad energy. There's no such thing as bad energy. Basically, we need to process energy. So when we go through trauma, energy gets stuck in a moment in time. For us, actually, I realized there's a point I didn't quite explain. When we have experiences like childhood trauma, car accident, bad boss, bad partners, bad marital experiences, energy gets lodged in our body. What that means, the way to release it, we need to act on the energy. Energy, we cannot talk about it. That's the reason I don't do the traditional therapy anymore. The only way to release the energy is need to act it out. Body, we need to move the energy. And body is very literal. Body, do something, say something, move something, or quit a relationship or start a new relationship. To move the energy requires action. Action is about, and there's another component of action. So when we get something come at us, we fall along those three dimensions: presence, connection, agency. Action is about you claiming presence, connection, and agency, or version of that. How do you claim that back? That's how you process the energy out. You claiming your own boundaries. And that action needs to have several components. Needs to be tiny, needs to be joy-based, something your body wants. Typically, whatever the source of struggle was, your action needs to be 180-degree opposite of that, so that you do something that disconfirmed initial experience. That's how you reconstruct and different narratives that brings your body to here and now.
There was another great question. Do you find a difference between childhood trauma and adult trauma? Children have virtually no control over their lives.
Yeah, so yes, I do. So there are a number of my clients that they've had the childhood trauma, sexual abuse. When sexual abuse happened, childhood trauma, and then or children who were punished or ridiculed or shamed, the work of therapy still following the same process, but the work is very gentle. Is very gentle. So the client that I mentioned, her traumas, it was surgical related. It happened in her teenage, and later on, she had enough ego strength to work through that. With children, When that happens, their body is very sensitive. Their body hasn't experienced safety, sense of connection, sense of trust. So the main thing is anything that at the tissue level, emotional level, even relationship with the therapist, with me as a healer, is very gentle. Gentle means a way for them to feel safety with another person. They have safety, and me creating an environment for them to feel safe, to open up so they can trust their own tissues more, their own bodies more, their own skin more, and allowing them to reconstruct. Really, this is about reconstruction, a sense of inner safety for them gradually to take back what was taken away from them. It's about building a sense of inner safety.
Thank you. That's all the time we have for questions. Dr. Mehran, thank you so much for bringing attention to this extremely important concept where healing really begins. My frustrations as a physician is that I have patients with anxiety and depression and past trauma who have undergone therapy for a decade. They have done every medication and there's been no progress. There's just been a numbing of their experience so that they can maybe get through their day a little bit better. But I find that the points you make are really relevant, especially in a time where post-COVID, all of the things going on in the world, there's such a huge burden of trauma and stress, and we don't have enough mental health providers to get to everybody. So you have brought such a practical approach in a relatively short period of time that people can use to really make progress. And it's so relevant with MS. I think if we were to ask people among a group of people with MS, there's childhood trauma there. I put a lot of links in the chat to the ACEs study and other resources. So please seek them out. We just have a few minutes. So we would like to hear from you. What would you like to see in the future? How can we be of service to you? Sanam is a health and life coach. She ties this work into her clients because it's important. You can't make as much progress if you don't tend to the past traumas, the past hurts, right? And in my online wellness program, we spend time on the mind-body connection and really trying to build coping skills and supporting each other to, again, bring this work into the care of multiple sclerosis. I think it's the one really big missing piece of what we're not telling our patients.
Maybe I can share with the group that my book will come out in May. The title is that You Are Not Depressed, You're Unfinished. And what I share with you today is all in the book. I hope you consider the book, share it with your colleagues, use it yourself. And starting next week, I'm very active on LinkedIn. I will start to do some of this, what I shared with you, in segments on LinkedIn. I see my work as an open source that with a single goal in life, really suffering, we should not be suffering. The science we've been practicing, the whole field of psychology, psychiatry, actually it's not a settled science. It is evolving very fast, and it will evolve a lot more. That once we know how humans get into a state of a struggle, we can reconstruct and reverse engineer back to health. And the work is faster, better results, and more sustained. So we all need to know that. So we raise better families, a better relationship, better workplaces. So if this work resonates with you, join us, then let's do this together.
Thank you. I look forward to connecting with you all. Please reach out. This is important. It's crucial to your self-care, and we look forward to seeing you next time.
Thank you so much.
Thanks, everyone. Be well.
Thank you. Have a great day. Bye, everyone.
Bye-bye.
Bye.